Support the patient's forearm across your forearm and tap the brachioradialis tendon over the distal aspect of the radius. A positive response is noted by a jerk in the brachioradialis muscle. Triceps reflex C7. Support the patient's forearm in a relaxed fashion across your forearm, and with the reflex hammer, tap the triceps tendon just proximal to its insertion into the olecranon. In the normal patient, you will be able to see the contraction of the triceps muscle or feel the extension jerk of the patient's forearm. The detailed neurological examination of the hand and wrist region is described in the video program on the hand and wrist. In order to document a complete neurological examination of the upper extremities, the neurological examination of the hand and wrist region would also normally be performed at this time. Special tests related to the cervical spine. Distraction test, compression test, Valsalva maneuver test, Adson test. Distraction test. Cervical traction is a common therapeutic modality used in patients with cervical pain and radicular symptoms. The physician can assess a patient's response to this form of treatment by performing the cervical distraction test. With the patient sitting and the neck in the neutral position, gently grasp the patient's jaw with the palms while the thumbs support the occipital region. Apply straight upwards traction and ask the patient if the pain pattern has altered. Note that relief of pain suggests that cervical traction may be a beneficial therapeutic modality. Compression test. Compression of the cervical spine can increase pressure on the facet joints and also decrease the size of the neural foramen. Hence, cervical compression can aggravate symptoms arising from these areas. With the patient sitting and the head and neck in the neutral position, place the palms on the vertex of the skull and apply gradual downward pressure. Note any increase in discomfort and also the exact distribution of any radiation of pain or paresthesias. Caution. The examiner is cautioned, however, that distraction and compression tests should not be performed on any patient with cervical trauma, and a compression test should not be performed on a patient with a suspected cervical disc protrusion. Valsalva maneuver test. The Valsalva maneuver increases intrathecal pressure. Instruct the patient to take a deep breath and then attempt to expire against the closed glottis, or to force as if they were having a bowel movement. Production of pain in the cervical region or radiation of pain into the upper extremities suggests the possibility of a space-occupying lesion such as a disc herniation or tumor in the cervical canal. Adson test. The Adson test is performed in order to determine any compromise of the subclavian artery in the cervical region. A cervical rib or compression by the scalenus anterior and scalenus medius muscles may decrease the patency of the subclavian artery. With the patient standing, assess the volume of the radial pulse at the wrist. Gradually abduct and extend and externally rotate the arm. Then instruct the patient to take a deep breath and turn the head towards the side you are examining. A decrease in the radial pulse volume or obliteration of the radial pulse suggests compression of the subclavian artery in the cervical region. This concludes the examination of the cervical spine, but the examiner is reminded that the examination of the shoulder region and upper extremities, as well as the neurological examination of the trunk and lower extremities, must be performed if cervical pathology is detected.